Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 9 video. This week we continue our discussion of guardianship, powers of attorney, advance directives, and other substituted judgment forms in long-term care. But this week we tend to focus a little bit more on financial abuse, and neglect. There will be some more about the differences in decision-making documents, and how decision-making documents affect facilities. So why are we still talking about this? The whole world of substitute decision-making is really important, and it's often a misunderstood issue. Not only the different types of documents and what they do, but also the darker side to guardianship, powers of attorney, and advance directives. Because these substituted decision-making documents are often giving the power to another individual to make decisions or act upon decisions that are made beforehand, they're often connected to cases of elderly abuse. And often these legal documents are used as a tool of that abuse. So, another reason is that often when you enter into an assisted living or residential care, a nursing home, and even with home care, a lot of the companies will ask that you prepare these financial documents to start the long-term care process. So one of the reasons these documents are so intimately connected with long-term care is that when you enter the long-term care system, you're often asked to prepare these documents. One of the other issues we'll talk about this week is financial abuse and how it's widely considered to be a misunderstood and largely growing issue. So, how prevalent are we talking? Well, there's quite a few different estimates out there, but some estimates are as high as 1 in 6 elderly people experience some form of abuse. And if you look on this slide, you can see the power and control wheel that talk about the different types of elder abuse. Abuse, somewhat counterintuitively, is statistically higher for those in institutions than in the community. So while we think of being an institution, you might be more protected because there's more eyes on you, statistics are showing that abuse is actually higher in facilities. Elder abuse, as we know, causes physical injuries, can be financial injuries, but it also includes a lot of long-term psychological consequences. And one of the effects of elder abuse is not only higher health care costs and poor outcomes, but just really damage to the long-term care system as a whole. So what is elder abuse? Elder abuse is a single or repeated act. It can include a lack of appropriate action, so neglect, that occurs with any relationship where there's an expectation of trust, which causes harm or distress to an older person. Now, this definition is somewhat broad, and there are different definitions out there, but it's meant to include both family members or caretakers, as well as not acting, so including neglect. So this is a broad definition that includes many different types of abuse. One of the things we focus in on this week is financial abuse. As I said before, financial abuse is underreported and a really understudied issue. Estimates range, but often sources will cite that Americans lose in the billions and billions of dollars a year to elder financial abuse. Statistically, many of these crimes are committed by family members and caregivers. So, people who work in the nursing home or the assisted living or come in for home care. Often, these crimes across the board aren't reported. There are multiple reasons for this. Two of the main reasons are that a lot of victims want to protect the abuser, maybe because they're a family member or they're their caretaker or they've otherwise taken good care of them. Maybe they don't have anyone else to step into that position. And another major reason that these are underreported because often abuse is perpetrated against people with dementia who have trouble remembering what exactly the abuse entailed. So, again, substituted judgment is really complex. We looked at a lot of this last week. But keep in mind, it can be used as a tool of abuse. So, these are cases where the power of attorney or the guardian is actually abusing the elderly victim. Another feature of these abuse cases that's really hard to prosecute is that you have this legal relationship where maybe the perpetrator has power to do the abusive things. So, for example, you have power of attorney documents that were signed, but the capacity of the elder person was really limited at that point. Or maybe they were under duress because they were afraid if they didn't do it, their family member wouldn't visit them anymore. We're not going to go into the other forms, but I do want to point out that abuse can happen through changing an elder's will against their wishes, putting your name on their bank accounts, putting their property into other people's names. So, possible red flags for financial abuse. I just want to go over them quickly because we will talk about them this week. Somebody who's overly interested in conserving money, being afraid that it's going to be spent on someone's care. A power of attorney or guardian who doesn't want to spend any money on the elder's care. New friends or old relatives, neighbors that start spending excessive time and expressing really a new affection for the elderly person. Or possibly a caretaker with an inappropriate level of interest in the elder's financial matters. So, like a CNA that comes into the home to help out the elder with toileting and showering, who all of a sudden is doing their bills. Other warning signs that you might see mentioned this week are large bank withdrawals, unrecognized signature on checks, checks written out to cash, expensive gifts given, sometimes really extensive correspondence with a brand new individual. And as usual, I want to give you my caveats. A lot of times this can be innocent. Often, grandparents want to help out their grandson by giving them money or buying them a car. There's a lot of different examples out there. So understanding that line between abuse can be really difficult. When there's a substituted judgment document or any kind of legal document that gives authority to another individual, scanning for elder abuse can often be a really complex task. And so not only do you have to review all the legal documents, but you really need medical professionals to weigh in on the capacity of the individual, both at the current time and at the time that they might have signed the documents. So that's it for week 9. There's a couple other videos that you can watch. As always, I'm here for your questions, comments, or concerns. This week has some thick issues like the other weeks, so really feel free to reach out if you want more examples of financial elder abuse. Thanks and have a great week.